Hey everyone, it's Dr. Jess. Welcome and welcome back to my channel. In today's video, we're going to talk about hypothyroidism. If you're new to the channel, please don't forget to subscribe and turn on your notification bell so you don't miss out on any new uploaded videos. Okay, let's get started. What is hypothyroidism? Hypothyroidism is also known as an underactive thyroid. So the thyroid gland produces two thyroid hormones. So we have T3 and T4. T3 is mostly formed when T4 gets broken down in the periphery. The thyroid hormone production is regulated by thyroid stimulating hormone, also called TSH. And TSH is secreted by the pituitary gland, which is why TSH is also one lab that your provider will check their value to see if you have a thyroid problem. With hypothyroidism, there's also a deficiency in T4. So low levels of T4 increase the secretion of TSH, and that creates a negative feedback loop. So with hypothyroidism, you'll have low levels of T4, but then you'll have a high level of TSH. Now, let's talk about Hashimoto's disease. Hashimoto's disease is an autoimmune condition. It is the most common cause of hypothyroidism. So with Hashimoto's disease, what happens is that the person's antibodies is attacking their own thyroid gland. What are the signs and symptoms of hypothyroidism that we need to be aware of? Some common signs and symptoms of hypothyroidism are fatigue, weight gain, cold intolerance, and a goiter, that's an enlarged thyroid. Depression, constipation are also symptoms. So I mentioned earlier that with hypothyroidism, you have a low free T4. So the T4 will be lower than the normal range. And then you'll have a high TSH. So the TSH value will be higher than the normal range. Patients who have hypothyroidism, usually you want a more aggressive control in pregnancy. So for example, in pregnant patients, they might want the TSH to be lower than with a non-pregnant patient. So more aggressive control. Let's look at this practice question together. All of the following are true about hypothyroidism, except most common cause is Hashimoto. Hypothyroidism is characterized by low levels of free T4. Hypothyroidism is characterized by low levels of TSH. Common symptoms of hypothyroidism include fatigue, weight gain. Let me know what you think the answer is in the comments below, and then we'll go over it together. I'll give you all 5 seconds. Okay, so let's look through it together. So A is true. Hashimoto is the most common cause. B is also true. Hypothyroidism is characterized by low levels of free T4. C is false. With hypothyroidism, you have high levels of TSH, not low levels. D is true. Some common symptoms are fatigue, weight gain. So the correct answer is C. The medication that is most commonly used for hypothyroidism is called levothyroxine. Brand name is Thyroid. So for this medication, different brands are not interchangeable. So you might get a little bit different of an effect even at the same dose. The side effects that you may experience with the medication are symptoms of hyperthyroidism, so things like palpitation, anxiety, increased appetite, weight loss. This medication should be taken on an empty stomach. 30 to 60 minutes before breakfast for optimal absorption. And TSH is usually checked every 4 to 6 weeks until levels are normal. Which of the following meds can be used to treat hypothyroidism? A. Levothyroxine, B. Methimazole, C. Synthroid, D. A and B, E. A and C. Write your answer in the comments below, and then we'll go through it together. Okay, so A, levothyroxine, so that is correct. That can be used to treat hypothyroidism. B, methimazole, so that one is not correct. So methimazole is used for hyperthyroidism, not hypo. C, Synthroid, yes, that can be used to treat hypothyroidism. So the correct answer is E, A, and C. Now let's talk about drug interactions. So first, let's talk about medications that can decrease levothyroxine absorptions. So we have antacids, calcium supplements, iron supplements. So these, if you're taking levothyroxine, you should separate by 4 hours to make sure that they don't decrease the absorption of levothyroxine. And then we have medications that can alter thyroid hormone levels. So some of these are estrogens, SSRIs. They may decrease the thyroid hormone levels. Medications that can increase the metabolism of levothyroxine, therefore can decrease thyroid hormone levels. So we have examples like rifampin, phenobarbital. So again, with all medications, always pay attention to drug interactions. How would you counsel a patient regarding the use of levothyroxine? A, it should be taken on an empty stomach at least 30 to 60 minutes before breakfast. B, its use is contraindicated in pregnancy. C, different brands of levothyroxine may not work the same, even at the same dose. D, A and B, E, A and C. Write down your answer in the comments below, and then we'll look at it together. Okay, so A is correct. It should be taken on an empty stomach at least 30 to 60 minutes before breakfast. B is incorrect. It is not contraindicated in pregnancy. Normal thyroid level is very important in pregnancy. Typically, patients who are on levothyroxine, when they get pregnant, their dose will increase because of the more aggressive control needed in pregnancy. C is correct. Different brands may not work the same, even at the same dose. So that makes the correct answer E, A, and C. That's all I have for today. Please don't forget to like, subscribe, and turn on your notification bell. I'll see you in the next one. Bye.